this is Lindy Kaiser with clearancejobs.com. It is Mental Health Awareness Month, so all this month we've been giving you content related to mental health and your security clearances. We had an article last week about mental health myths related to the security clearance process. I'm going to unpack some of those on this video cast today. So number one, the top myth I see about mental health and security clearances is that all counseling has to be listed on the SF-86. The fact is that the SF-86 asks about specific disorders or issues. It asks about hospitalizations, but an update made to the SF-86 in 2016 clarified that the government does not need to know about proactive counseling. In many cases, counseling related to anxiety or PTSD. A big part of that is we saw a huge quantity of service members coming back and having issues with PTSD or trauma related to military service and avoiding seeking any form of counseling and using their security clearances as an excuse to do that. So there was a lot of work across the military community to say, hey, we want to reduce stigma. If one of the ways we can do that is making folks not have to report any proactive mental health counseling, that would certainly help it be a little bit easier maybe for them to seek counseling related to, again, trauma or even marriage issues, anxiety, other factors. The SF-86 is very clear about what needs to be listed on the form. It also clarifies that even if you have to list one of those disorders, that doesn't necessarily mean you'll be disqualified from obtaining a security clearance. It just means the government is going to need more information. Number two, the next top myth I get a lot of questions about is psychiatric stays or hospitalizations and security clearances. I heard from many applicants who have said, hey, I have heard that if I have a hospitalization, I will not be able to obtain a security clearance. That is simply not true. As the form indicates, you have to list that. I think that's why it creates a lot of anxiety. People assume, hey, the government is specifically requiring me to list these. They want the dates, they want provider names. Because of that amount of detail, a lot of folks are worried that that's going to mean automatic denial or revocation. Especially when it comes to mental health issues, the government is going to make the decision based on the whole person concept. So if you have a hospitalization that was a decade ago, for instance, or even if you have a hospitalization that was recent, even if you currently have a security clearance and you need to have a stay at a psychiatric facility to address an issue, the government is going to be concerned, A, what was that diagnosis, and B, are you fulfilling the recommendations for treatment provided by your provider? So you will have to give that information. I know it's hard sometimes to provide and disclose that. Stigma certainly still keeps people from providing information, but your mental health is more important than a career. Your mental health is more important than the temporary awkwardness of having to tell your security officer about a psychiatric stay or visit. Better to disclose, and again, if you're following through with treatment options, your chances of obtaining and maintaining a security clearance are certainly quite high. Number three, biggest myth that I see related to mental health is that, hey, my trauma is classified or happened in the course of my national security career. That means I couldn't talk about it anyway. So people use that as an excuse to not go get the help they need because they say their trauma is classified. The reality is most government agencies working in this space across the intelligence community, the national security community, have qualified mental health providers that are cleared. So there's somebody with a security clearance that it can actually provide mental health treatment. So certainly seek out your agency. Go get help through official channels if you have trauma that is classified that you need to talk to. But I think the other thing to certainly be aware of is that not all forms of therapy or mental health treatment are talk therapy. So if you're just one of those people that just doesn't want to talk about things, but you are struggling with anxiety or depression or other issues, again, be proactive, seek help. There are other forms of therapies out there. There are things that certainly can be done to help you address your issues that don't necessarily even require you to spend a lot of time talking about that. Because if you work in the national security space, I know there's a lot of folks that simply, you get used to not talking about what you do at work, and that just becomes normal. Again, there are certainly cleared mental health professionals, again, especially with the intelligence community agencies you could reach out to if that is not the avenue that you want to pursue. However, there are a lot of treatment options where you can talk, you can go through it, you can process things in other ways that don't involve talking about the specific trauma. All that to say, read all of our other content over at Clearance Jobs. We discuss a lot of these things, what to expect from a security clearance psychiatric evaluation, the mental health adjudicative guideline, what it actually asks, what it doesn't, what is on the SF-86 and what isn't. There's just a lot of nuance here. And knowledge is power. I think it will help decrease your anxiety if you know what the form is asking and know what the self-reporting requirements are. But the main mantra that especially across DCSA, ODNI, they're trying to provide is that post-COVID, we're all dealing with, again, whatever this new normal is, going back to the office, navigating work, life, all of that. Coming out from under the stress of the past few years, it's certainly been life-altering. And so seeking, again, proactive mental health treatment is better. A lot of times we see the long tail when it comes to traumas or issues. So, we're dealing with things. We don't want to have this mental health crisis hit several years down the road because you went through a lot and, had that anxiety and depression and the issues and didn't address it. So across the national security community, they are really emphasizing, please, if you are struggling, go get proactive health and treatment. A lot of employers across the defense industry have these, employee programs where they will help even provide and finance you to do a telehealth, to call somebody, to meet with somebody in person or virtually. So there are so many different avenues out there. So get help, seek help, and don't be afraid of the stigma. I think that's a big thing that we're trying to get across the community, because working in national security and within this community can certainly be stressful. I want everyone to get the help that they need this month, Mental Health Awareness Month, and always. So for more resources, tips, and information, definitely visit us over at clearancejobs.com.